Good evening, everyone. This is Rebecca Shrook, Director of Alumni Relations. Thank you all for joining us. We're going to get started pretty shortly. We're going to give it about 5 more minutes to let everyone get signed in and get started. So we will be starting in about 5 minutes. And thank you all. We're looking forward to the presentation. Good evening, everyone. This is Rebecca Shroot, Director of Alumni Relations, and I want to welcome you all to tonight's online presentation, an insider's look at what's new in diversity and inclusion in healthcare. Great. So just a few notes for this evening. If you are joining us by telephone, please just make sure to mute your phones. And then please feel free to submit questions throughout the presentation by using the question box on the right. We will be answering questions as it pops up, as they pop up during the presentation. So don't be shy and please feel free to ask. So this evening, we have more than 83 alumni from 19 states participating in tonight's event. So thank you all for joining us. We really enjoy doing our online programs because we are able to reach out to a lot of you that we may not come to do an event in person. Tonight we have Dr. Bernie Lopez, class of '86, joining us as our speaker, and he will of course go a little bit more into detail about all that he does here at Jefferson, but we are very happy to have him this evening as our speaker. And I just wanted to let you know, for those of you that might be in an area that we are coming to, we have a few upcoming events for the winter. In February, we'll be in Florida with some of our 1824 talks. In California, we have the American Physical Therapy Association reception in New Orleans at the end of February. And in March, we'll also be back in Florida with one of our new talks, Caregiving Under Fire, Jefferson and the Vietnam War, as well as the Jefferson Alumni Day with the Phillies in Clearwater for spring training. So we look forward to seeing those of you that can make it to one of our in-person events here. And just let you know, we are also planning for this year, so please let us know your ideas, and if you're willing to volunteer as a speaker. We love featuring our alumni in any interesting topics, so feel free to email us at alumni@jefferson.edu. With all that said, we're going to get started with Dr. Lopez. So I'm going to bring up his PowerPoint and then give him control, and then we're going to get started.
Great. Am I good to go?
I believe so. Go ahead, Dr. Lopez.
All right. Well, thanks. So welcome, everybody. Hello to wherever you are in the United States here. I'm happy to have the opportunity to tell you a little bit about what's new in diversity and inclusion at Thomas Jefferson University. So when the title, I think, is the insider's look, I might now be considered one of the ultimate insiders, because I've been at Jefferson now for, it's pushing 36 years since I started medical school back in 1982. Let's see. All right, Rebecca, I'm not sure.
You should be able to use your arrow key on your keyboard to just advance the next slide. So let's see if that works.
It's not seeming to do. Hold on. For some reason,
there we go.
Sorry about that. All right. So again, the ultimate insider. I'm born and raised in Philadelphia. In my 57 plus years, I have actually not spent a whole lot of time outside of Philadelphia. So born and raised in Philadelphia, I went to undergraduate at the University of Pennsylvania, graduated in 1982. Graduated from, what's now Sidney Kimmel Medical College. Back then it was known as Jefferson Medical College in 1986. I did my residency training in emergency medicine and did that at Thomas Jefferson University Hospital, where I finished that in 1989. And really, for all intents and purposes, I've been at Jefferson for my entire career. I did spend a little time away, but I've been faculty since I graduated in 1989. So much of my work has been done in emergency medicine. In fact, my career path was headed towards becoming an academic chair in emergency medicine. So when I talk about what's new in diversity, a lot of what's new in diversity at TJU kind of parallels my own career. My development, my activities were again largely focused on academic emergency medicine. The director of clinical research. I was the residency program director. At the same time, I had a fair amount of involvement in the medical school. I was the associate dean for student affairs and career counseling for about 12 years on top of all of this. So in 2013, I ended my role in student affairs to focus on my career in emergency medicine. And it was probably in July of 2013 when I was asked to become the Dean for Diversity and Community Engagement in the medical school. Now, granted, I had no formal experience in this area. I was asked to do essentially asked to do a job to really enhance our diversity and inclusion efforts within the medical school. So in September of 2013, I took on the role of Associate Dean for Diversity and Community Engagement. And really, that has now become my career. So starting back then, when it was a job that I was doing in parallel with emergency medicine, it's now become my career. Most recently, I recently, it's about a year ago now. So in January of 2017, I added the title of Associate Provost for Diversity and Inclusion for Thomas Jefferson University. So not only did I maintain my role in diversity and inclusion in the medical school, but I added on the role of overseeing our efforts across the academic pillar. So in many ways, I'm the Dean of Diversity in each of the colleges that makes up Thomas Jefferson University. And as many of you may know, we've merged with Philadelphia University, so I have oversight and responsibility to what's now our East Falls campus. And I'm still an emergency physician. It's still one of the fun things that I do. I still see patients. I'm the vice chair in the Department of Emergency Medicine. So that's a little bit of my background. So when I think about diversity and inclusion, and I know we have alums that are SKMC. We have alums from the various colleges of TJU. My background is largely in the medical school. And as you'll see as we go through my PowerPoint, there are a lot of things that really do apply to all of TJU. But pre-2013, so that's pre me coming on in my role, pretty much all of the diversity activity, anything related to diversity, inclusion, health disparities, for the most part, and while it existed in some forms throughout the various colleges, for the most part, diversity and inclusion activity at Thomas Jefferson University resided in the medical school. So again, back then it was Jefferson Medical College. And really what diversity and inclusion was, it was a scattering of diversity-related talks. There were a variety of celebrations, and much of the activity was really focused on student group activities. So there was not a lot of activity that was happening at the faculty level, at the resident level, at the staff level. It was largely focused on student activities. Currently, the office that I work out of in the medical school is called the Office of Diversity and Inclusion Initiatives. Back in 2013, it was called the Office of Diversity and Minority Affairs. And I'd say the majority of the activity was supporting student groups. It was also recruiting visits to colleges and fairs. So there was some cultural competence, cultural sensitivity education, and most of the focus on diversity and inclusion was really on workforce diversity and student body diversity. So that was pre-2013. When I came on as the diversity dean, so it's not just me, diversity and inclusion is not about me, it's about many of us. Well, there were a group of us that were leading this effort, really took a different approach to how we do things. We really took a much bigger focus on the patient. We removed our focus, the primary focus that was on the workforce, and put it somewhere else. So where we are now, I'll sort of fast forward to where we are in 2018. Much of what I'm going to show you in these next couple of slides are, I'd say, relatively recent developments. I'd say much of it happening over the last 2 years. We now have a Jefferson definition of diversity and inclusion. All right, so you can take a look at the slide. For those of you who aren't on the phone and are in front of a computer, you can see that how we look at diversity and inclusion. And these are the definitions that we have. The definitions probably, developed about 1.5 years or so ago. Diversity is simply the richness of human similarities and differences that make up the one Jefferson family. Inclusion is the ability to provide outstanding health care to all people and all communities while giving everyone voice and the opportunity to be valued and respected and supported. So not anywhere do you see workforce diversity, student body diversity, but it's really taking a more global view, a more global definition of diversity and inclusion. I say this was developed about 1.5 years or so ago. Our organization has changed greatly. Certainly starting about 4 years ago, but in the last year we've merged. We've now merged with 3 health systems and an undergraduate institution. We just recently added McGee Rehabilitation to the Jefferson system. So it's really grown greatly. And our definitions are likely to change in some way to accommodate that great growth. We support health equity, and again, we're trying to figure out how we're going to work Philadelphia, or I should say East Falls campus now. But our focus is on health equity. So it's all about the patient, all about taking care of the patient and being able to provide that best, most culturally sensitive care. We still pay attention to workforce diversity, student body diversity, supplier diversity. It's still important. It's still how we're measured. But why is it important? Because it really supports all that we do in order to provide health equity, to remove health disparities. And we really put the focus of our diversity and inclusion work into the care of the patient, the best care of the patient. Who are we? So in 2013, it was just me. In 2013, I was the only one in the organization who had the word diversity in their formal title. We've grown greatly just within the Office of Diversity and Inclusion Initiatives in the medical school. Maybe about 3 months after I came on, we added Tracy Trice. Tracy is a family physician at Jefferson. She has the title of Assistant Dean for Diversity and Student Diversity Programs. In 2015, we added a Chief Diversity Officer for the entire health system. So We went from having just me in the medical school to now having somebody who basically reports directly to the president. Our president, Steve Klasko, is somebody who I really feel believes that of the importance of diversity and inclusion with his heart, and he put things in place to demonstrate his commitment. So Joseph Hill is works in the Enterprise Office of Diversity, Inclusion, and Community Engagement. He's Senior Vice President and Chief Diversity Officer. As I mentioned, I have the role of Provost, Associate Provost for Diversity and Inclusion. Again, providing senior guidance and leadership across a larger part of the organization. It's not just me, it's not just Joseph Hill, it's not Tracy Trice. We actually have representation from all across the academic pillar, and I'm going to show you a little bit more about the enterprise, but we have what's called the TJU Diversity and Inclusion Academic Action Council, in which we have formal representation from each of the colleges that makes up TJU, each of the colleges, a campus of East Falls, as well as the key offices, key areas throughout the academic pillar, to make sure that we have the thoughts, ideas, that we are able to identify the needs of the different parts of the organization. So again, there's a structure, certainly on the academic side. The definitions of diversity and inclusion, again, we have our formal definition of diversity. Inclusion, the definition that I have here is the definition that we talk about very much throughout our leadership, and that is simply that inclusion is the valuation of diversity, and this valuation allows one to bring their whole self to work, that allows those that we serve to bring their whole selves, and we believe that by allowing people to actually bring their whole selves and not have to hide certain parts of themselves, that we're able to provide the best care, the best service, the best education. And there is a business case that there's literature that abounds, not just in the health care sector, but all throughout business, education, law, in which it's been demonstrated that diverse and inclusive organizations outperforms those who are not. And we aim to be one of those high-performing organizations. It's not important that you can certainly look through all the different boxes to see, but again, this is something that has grown over the last 3 years since Joseph Hill has come. But just know that there is a organizational structure to diversity and inclusion. So it includes all parts of the organization, the clinical side, the academic side. This is the structure. And again, this was something that did not exist, for the most part, 3 years ago. So if you're an alum and you graduated from Jefferson in the last 3 years, you may have heard of some parts of this. If you're an alum who graduated 4 or more years, this was non-existent. So again, I just wanted to show you that there is a structure in place to assure that we're looking at this in a careful way and that we're putting things into place, that we're enhancing diversity and inclusion efforts. And rather than leaving it up to the goodness of people's heart, we actually have a structure in place to assure that this happens. If you look at the second box, for those of you who can see it, there's something called the Jefferson University Diversity, Inclusion, and Community Engagement Subcommittee. There's actually a subcommittee of the Board of Trustees that is focused on diversity and inclusion. So it's really one of the ways that we're using to drive our efforts from the top. And at the same time, we're grassroots efforts, initiatives to also drive it from the bottom. The other thing I wanted to just stress on how we look at diversity and inclusion, again, the focus is on the inclusion piece. So when we look ahead, this is a slide that I used at our strategic planning meeting for the academic pillar. And I asked, well, how are we going to support our growth in the future, and what are some of the things that that we plan to do? We'll get to the other pieces of this later on, but the important part is at the top where it says in yellow, promoting and assuring a culture of dignity, respect, inclusion, and valuation of diversity. That's how we aim to promote diversity. That's how we aim to use diversity and inclusion to assure that we're growing in the best way that we can. And again, what's our growth? Our growth is in serving our constituents, our community, our patients, our learners. So that's really, I just wanted to highlight that at the top. All right, action plans. All right, so this is a recent within the last couple of weeks, how we, the action items that we aim to put in place in 2018. So again, just to give you a picture that we're looking at this broadly from an organizational point of view. Some of the things to point out, we're in the process of developing a diversity education platform, a way for us to educate every member of our organization. Just actually had a meeting on this today. We're trying to develop a way to educate all 30,000 people that make up Thomas Jefferson University and the Jefferson Health System, developing a collaborative, Philadelphia Collaborative for Health Equity. These are just a number of our top 10 musts, as we call it, our action items that we aim to institute in the year 2018. Some of them, we have quickly approaching deadlines, June of 2018 for some of these. But our goal is to make sure that these things happen, because we think that that will be evidence that we are truly moving forward in our efforts. What I'm going to do next is I just want to give you some examples of activity that is happening at Thomas Jefferson University. So again, much of my experience is in the medical school. Much of the activity has been in the medical school. I can tell you in my role over the last year, I represent Thomas Jefferson University. So I'll give some examples of what we've done in the medical school, but what we are in the process of doing. And then we have varying levels of success in that area, meaning getting things instituted, but just know the examples that I share with you from the medical school are things that we're doing in all of the colleges and East Falls. Faculty, so in the area of faculty, the way we recruit is we do it in a targeted, comprehensive fashion. So used to be we'd send one person out to recruit, tell people about Jefferson, the medical school. We send teams of people out to recruit, faculty, residents, students, that giving the potential applicant to wherever they're applying to, give them a chance to see different viewpoints of Jefferson. Again, this is right here. This slide here is focused on SKMC. We actually have, and we developed the SKMC search and hiring policy, which was designed to assure that when we interviewed people for a faculty position, that we had a sufficiently diverse candidate pool from which to draw from. This is a way to, at the very least, get the thought process of having a diverse candidate pool, having diverse faculty. That search and hiring policy and SKMC has since become the Thomas Jefferson University search and hiring policy. So we're able to really broaden it to include all of Jefferson. With regard to retention, we sponsor a variety of activities, faculty development. What you see on the slide here is really aimed at medical school faculty, but again, we're looking to do the same thing in the other colleges within TJU. We have a a new underrepresented minority faculty, we call it a individual career faculty counseling meeting, where Dr. Karen Novielli, who's our vice provost for faculty affairs, she's the vice dean for faculty development at the in the medical school. She and I meet with all new underrepresented minority faculty as they come on board to simply welcome them, offer us to them as resources. Our definition of what is underrepresented depends on the field. So, for instance, in the surgical specialties, women tend to be they're considered an underrepresented group in medicine. So, and it's just an effort to address any unique concerns that a new faculty member may have, but more importantly, it's simply to welcome them and give them some advice and guidance as to how to best assimilate into the Jefferson faculty. With regard to graduate medical education, we do the same thing with recruitment, same team approach. Here's something new that we've done. Again, this was focused on graduate medical education. There were 2 residency program directors, the Office of Graduate Medical Education, my office. We developed an 18-month cultural competency curriculum for all residents at Thomas Jefferson University Hospital. I'm gonna flip to the slide just to give you an idea of the different topics that we covered. We developed a curriculum in which we split the sessions between what we might call interpersonal skills development. So we're trying to get the residents to give them an education on skills that may help them as they interact with other people, with patients, with colleagues, with other healthcare providers. The other sort of education that we wanted to give was on things that are related to health disparities. We put in structural racism in medicine. So the intent was to standardize education. We had found that there was sometimes little to no specific education in health disparities, cultural sensitivity. It was so variable throughout the various residencies, we decided, well, why not standardize it and make it an offering to all? We first started out with the residents at Thomas Jefferson University Hospital. That has now grown with the use of technology and live streaming. We actually live stream this to all of the parts of the organization. So that includes Abington, well, and I'm going to use Abington Hospital, ARIA Hospitals, which is now Jefferson Northeast, Kennedy Hospital, which is now Jefferson, New Jersey. But it's a way to standardize education, to get education across the organization. Again, we're actually looking at using this and to develop that all cultural sensitivity, diversity and inclusion education for the entire organization. This is another, just an example of a way that we're looking at the educational resources that we currently have at Jefferson. Is there a way to take what we already have and apply it to the entire organization? So we're in the process of, again, part of it is standardizing the education. A lot of it is simply getting out what already exists to many people. And again, it's an example of how we look at things, how we're trying to do things on a system-wide basis rather than doing it on an individual, you might call it haphazard way. We're trying to do this systematically with concerted effort and thought, and really trying to deliver it all throughout the organization. In the various curricula, and we're looking at the curricula of all of the colleges and as well as East Falls campus, we're really taking a hard look at the various curricula to see, well, what is offered in the area of diversity, inclusion, cultural sensitivity. Some of you may know that we've redone the medical school curriculum starting this year. This was the first year that we did this. We changed the way we teach our students. In the process of changing things around, we wanted to make sure that they didn't lose, well, we want to make sure they didn't lose any of the education that they had gotten before. One of the pieces we wanted to make sure that we, not only did we not want to lose it, but we certainly wanted to enhance it, was how do we weave this throughout the education in Jeff MD? And again, we're doing this in all of the colleges that make up Jefferson, taking a look at how do we teach this? How do we weave this in? Our student groups are highly active. All right, that's one area. That's where I say most activity with the student group, certainly related to diversity and inclusion. A lot of the work that they do in this area is really related to health disparities, getting out into the community and helping to serve patients, helping to serve underserved patients. So this particular slide in the presentation just kind of outlines some of the key areas that we're looking at. So for instance, there's a lot of activity that goes on in health disparities. We're also looking at education disparities as well. Our students are involved in our recruitment. Our students are involved in curriculum development. That's both it's extracurricular, co-curricular, and curricular. Our students sit on our curriculum committee and have a say. They feel that it's very important that cultural sensitivity, health disparities education is part of it. And then I'm going to describe how one of the ways that we help to reduce health disparities through our language service program. We developed a program in the medical school. This is now the third year that we've had it. And again, I mentioned the medical school. We are expanding it to include students from all colleges that make up TJU. But here's the idea. First-year medical students who are fluent in Spanish sign up for this course. They get credit. There's humanities credits that our first-year students have to fulfill. This is one of the ways to do it. We take fluent in Spanish medical students. We put them through a 6-month medical terminology course. At the same time, they shadow at a clinic in the city of Philadelphia called Puentes de Salud. Puentes is a clinic that's it's for underserved Hispanic immigrant patients. I'd mentioned the education disparities. We actually participate in the education of the kids of those patients. But in any case, they shadow there. They shadow in one of our, it's in our new Latino women's health center that has just been recently established. But the idea is that we're taking students fluent in Spanish, giving them medical terminology, giving them exposure to patients, allowing them to use what it is that they learn. When they're at Puentes, they talk with the patients. They help with the conversations that are ongoing. And in the end, they help to reduce health disparities because they're helping to improve communications. We send them, those students, we send a small group, a subset of them for an immersion experience in the summer between their first and second year. We sent 3 of them to a hospital in Colombia this summer where they learn, they get different experience. Second and third year, they continue their shadowing experiences. They continue to help provide care at Puentes de Salud. In their 4th year, they again get another immersion experience. The experience being different in that they now go with their language skills, with prior knowledge, and with them being fourth-year medical students. So again, it's a longitudinal curriculum that was developed largely initiated by a couple of our medical students to ultimately help reduce health disparities, to create health equity. And again, I've been in conversation with faculty from health professions, from health nursing, about involving their students in that, ultimately looking at making this a team approach, getting more people involved. Research, so to put some science behind the work that we do, we're involved in supporting research that looks at, again, topics that are of interest and importance in the diversity and inclusion world. Here's the first author on this particular presentation. She is now a third-year medical student, and she presented this work at the Gay and Lesbian Medical Association that happened to be here in Philadelphia this past fall. But again, looking to put some science behind this, looking to really discover new ways to provide better care. We have a journal club that we did with our medical students where we sat and talked about a particular paper that looked at, you might say, some of the limitations. What are the limitations with what's called race-based medicine? We sat and went through the science of how one critically reviews the literature, and then we spoke about what that means when you have a paper that suggests that we either should not. Some people think we should, but this paper suggests that race-based medicine is not a sound way to practice medicine. Again, an attempt to add, we were putting some science to the work that we do. Scholarships. We have more scholarships now than we've ever had before. We had a donation from the Baxter family, who ultimately, they have now awarded 10 full scholarships, 10 4-year scholarships to the medical school for underrepresented minority students. We have a donation from a fraternity called Boulay, who are here helping to support African American male students, who a truly underrepresented minority in medicine, helping to support scholarship for that. And Dr. Mark Zwanger, who happened to be a faculty member when I was a resident in emergency medicine, made a donation for scholarship for LGBTQ students. And we're looking at the same sort of thing for the, we've been in discussion, health professions, nursing. What can we do about scholarships for students there as well? Our pipeline programs, this is how we grow people, how we take young kids, get them interested in careers in the health professions. This started out largely as in our Future Docs program, which was focused on really getting high school kids interested in medicine, and we grew that program to include all of the health professions, all of the health-related fields that we serve at Jefferson, to give kids a chance to learn about the variety of career options that they have. The idea behind this is really to develop, it's focused on underrepresented minority students, but it's really to help them to develop. It's to provide experiences, it's to provide academic enrichment, and it's to provide them guidance throughout the process so that they can have as much chance for success to make it to each of the next stages. We have a Saturday Academy for middle school students. We have the Future Health Professional programs. That's our high school program. And we have a program called Summer Training and Enrichment Program for Underrepresented Persons, or STEP UP. The first one was for medicine. We have one now for occupational therapy, physical therapy, nursing, and by this summer we will have one in biomedical sciences as well. So really just to grow these pipeline programs for all of the colleges that make up Thomas Jefferson University. This is our class of 2017, the summer that just passed. We had 15 students who lived with us for 2 months. They got to know us, we got to know them, they got to really immerse themselves. They got a MCAT preparation course, they got shadowing experiences, but it was a chance to help them develop academically so that when they went to apply to medical school, that they would have the best chance for success. A couple of our medical students, we take 2 of our medical students, they are the ones, we employ them, they help us to run this particular program. Developing partnerships with the first 3 with historically Black colleges and universities so that we can engage students from a very, when I say very early age, from freshman year, and the intent is to be involved in their development as they consider careers in medicine, the medical sciences, in healthcare. We're partners in a program called STEM Up Delaware, which is the pipeline program. It's middle school and high school students in the state of Delaware. So we're the partners in that particular program. Just throw out, we started something new. This year we have a lecture series called Confronting Racism, Bias, and Social Injustice in Healthcare. This actually stemmed from a course that two of our now third-year medical students, when they were second-year students, created a course called Race and Medicine that looked at structural racism. They ran that course for our first-year medical students. When they became third-year students, they got very, very busy, and we wanted to continue on in some way this education in this particular area. So course offered the first-year medical students. This lecture series is offered to the entire enterprise. We live stream it. We give everybody the opportunity to. Our first talk this year was by Dr. Damon Tweedy, a physician who wrote a book called Black Man in a White Coat, A Doctor's Reflection on Race and Medicine. We had him come up, talk a little bit about his experiences in his book. This had to be one of the most attended events on campus. We had 2 sessions. We asked them to do 2 sessions. We had 600 people attend live. This was live streamed to our East Falls campus. And we actually engaged him afterwards to get his ideas. What do you do at Duke University where he is? What are ways that we can incorporate this into the education in at our institution? These are the other topics that we have, just to give you an idea of, I guess you might call it a more structured approach to a lecture series, and really an opportunity for us to help educate our organization and hopefully also to stimulate thought. This is and this will be an ongoing series. It won't end after these 4 talks, but again, the intent is to provide education and stimulate thought. I give a talk on unconscious bias. This is my area of interest, and I'm not sure that I can say expertise, but I've certainly given enough of these sessions. It's an area that I feel is important as we think about how we deal with each other, how we can be more inclusive in the way we think. This past year, every student at Thomas Jefferson University, I gave this session at every orientation. For the medical school, they get it four times. It varies by year, but every student at TJU has had the chance to participate in this unconscious bias session that I do. Just real quick, I purposely don't focus on the numbers. Again, the idea is having a diverse environment, but most importantly, making sure that it's inclusive. The fact of the matter is the numbers do count. We are measured. So what I want to do is just briefly, I want to give you an idea of where we stand, our workforce, student body diversity at TJU. This is the diversity, or this is the demographics of, these are racial and ethnic numbers for our TJU faculty. So I probably don't need to point out the fact that we are not particularly diverse, all right? Certainly when we compare ourselves to national standards, especially when we compare ourselves to the demographics of Philadelphia, we are not anywhere near as diverse as we should be and need to be, right? And that's just how we look at it. Again, this is how we're measured. This is one aspect of diversity and inclusion. And this is why all of our efforts, or many of our efforts, certainly in diversity and inclusion, are aimed at increasing the diversity of our organization. So if you take a look, that's TJU faculty. Our student body is really not all that different. Perhaps it's a little bit more diverse than our faculty. But in fact, it is a little bit more diverse than our faculty, but it's not significantly more diverse. When we look at our staff, our staff is more diverse. This is the staff of on the academic side. This does not include the staff on the clinical side. It probably mirrors what we're seeing in the academic area. Our staff are certainly, they are more diverse. And again, it's taking a look and trying to make sense of what this all means and where it is that we should be going. Really, just to kind of wind down, so that's highlights. I wanted to give you the approach, our way of thinking, the organization within our organization that surrounds diversity and inclusion, some examples of things that we're doing. What are our next steps moving forward? Well, in large part, it's to continue doing the things that we are doing and grow them. I put this slide back up because it's really, when I say what do we need to do to move forward? Well, we need to continue with the focus on the patient or our students. It's really making sure that we are building that environment, that we're enhancing that environment, that we are diverse and inclusive to support ultimately who it is that we're here for. I put this slide back up again just as a reminder that it is about promoting and assuring a culture of dignity, respect, inclusion, and valuation of diversity. It is not about getting the numbers right. It is about making sure that we have an environment that has dignity, respect, and inclusion. Again, this slide from a presentation that I gave at the strategic planning meeting are just a list of some of the items, some of the things that we're doing and the way that we're moving forward. So it's thinking big, it's thinking systematically, and at the same time, it's paying attention to all the little details, all of the smaller components that go into making sure that we're taking care of that big picture. At the bottom, in July of 2018, the university will look a lot different. So if you remember from one of the early slides when I showed our Action Council, I showed perhaps there were 7 boxes at the bottom with the one green. There, with the merger with Philadelphia University, with reorganization of some of the colleges, this is what our organization will look like in July of 2018. So it's making sure that we pay attention to those many, many boxes as we're looking at all of the boxes together as a whole. All right. How do we plan? I told our all the key leaders when we're looking at strategic planning for the future, they said, well, what do you need to make this happen? And it was not all that different than in many other parts. We need human capital and investment. So we need dollars, but mostly we need people that are tasked with doing the things that need to be done. We need managers and directors. We need data. we need scholarship. There's many, many things that we need that we continue to work on. When I look to the future and what is it that needs to be done, in front of everybody, I said, this is what we need most. It's a commitment and accountability from senior leadership to make sure that this happens. So with that in a nutshell, I could talk for hours on this topic. I'd probably talk to you for an hour on each of the various slides that I showed, but I want to give you just that overview of what's happening at TJU. For those of you that are not graduates of SKMC or JMC, I just want you to know that we are looking at this for the entire organization. We want each area, we want each college, we want each department, division to have the most activity, to have the best activity in diversity, inclusion, cultural sensitivity, because we think that's what sets up the best environment for the work that we do. And we think that it really ultimately allows us to best serve our consumers, our patients, and our students. So just know, for those of you not SKMC, activity is happening in all parts of the organization. And that perhaps is one of the biggest, when you say what's new is that we're doing this all across the organization. So with that, I thank you all for staying on, for listening to me over the internet through a webinar. And I hope that you found this to be informative, and I hope that it makes you feel a little bit better about the school that you graduated from.
Great, thank you, Dr. Lopez. I'm checking right now, and we don't have any questions yet. So, oh, actually, one just came through. This is great. Hold on. Just trying to see it a little better. Let's see. So while doing recruitment fairs through SNMA during my time at JMC, now SKMC, one of the primary determinants of prospective students choosing other programs with scholarships. Would be interested to hear your thoughts on other factors that have been identified by applicants about reasons they opted for other programs.
So that's a great question, right? And what I'll say is that the data that we have, right? So the data that we have comes in, you might call them exit interviews. So our Dean of Admissions will ask people, all applicants, why did you choose another school? And then we break it down and we look at different groups. And when we look at our underrepresented minority candidates, the common answer is, I got more money somewhere else. Right? So that's the data that we have. So it would be easy for me to say, well, if we had more money, we'd be able to give the scholarships and we wouldn't lose those people. That's on the surface the easy answer. And we think that there's a lot to it. I think that the scholarships, the recent scholarships that we have been able to give based on those donations, and thanks very much to the work of institutional advancement. So I will tell you, well, all the money that's donated from a lot of people really go to help. That's the data that we have. The question that I always have is, how much does environment play? What role does it play in whether a student chooses us or not? It's something that I don't think anybody would ever put down in print. I don't think they'd ever put down in some print. I don't see enough people. I don't see many people who look like me. That's the question that I have that I don't know that we'll ever get to. This is the work that we do, is we're trying to promote the environment of inclusivity. I tell prospective medical students, if you come here, you can look at the data and see that we're not the most diverse medical school, but we are making great strides. And if you come to our medical school, you can really help to make changes. So to answer your question, the data says it's money. The unknown data that I just don't know that we'll get to is how much does environment play, what role does it play, and how much of a role does it play?
Great. And then we have kind of a two-pronged question. So just as similar to Spanish language immersion program, is there something similar for Asian community, especially when Jefferson is close to Chinatown? And also, how are diversity activities prioritized for various ethnic communities when considered for these inclusive activities?
So my vision, our vision is that we have that similar to our medical Spanish program. I want one of those for, almost every language that we could conceivably encounter. So I think that's a great point that, yeah, we're very close to Chinatown. So that is we will, let's just say that we will see plenty enough patients coming from Chinatown. So yeah, we need a medical Chinese, medical Cantonese, medical Mandarin. We need medical Cambodian. We need medical Vietnamese. So the answer is no, we do not have that. Yes, we would like to have that. The easy answer, actually it's not the easy answer, it's the real answer is the limited resources that we have. So the answer is no, we don't have it. Yes, we should have that. And that is certainly on the table as we move forward. As far as prioritizing, there's no formal way that we prioritize. I know certainly with student activity, we prioritize it. A lot of the priority is based upon the amount of student activity. That might be the amount of work and dedication. We look at our populations, we try to guide our activities in some way based on the populations that we serve. So that might be the one way that we got. I can't say that we've used that in a very formal and scientific manner. Our hospital, we do a community health needs assessment that really tells us what the community, what the real needs in the community are. And what we've been doing is we've been trying to focus our activities in those areas of need. So that might be, I'd say it's, I would say general concept, not a formal rule as to how we actually make those priorities. And again, I'm speaking mostly from the medical school.
Great. And then we're actually getting a lot of questions now, Dr. Lopez. So one of the questions we did have from Karen Mitchell, and some of you may have been thinking about this, we did ask, do your financial donors have the option to designate which programs their money goes to? I just want to make a note that when you do make a gift to Jefferson, you can designate which scholarship or program you would like your money to go towards. If you have any further questions about that, you can email us at alumni@jefferson.edu, and we can put you in contact with the proper people to make sure your money is funding what you want it to fund. Let's see here. So Dr. Lopez.
Yeah, and what I'd say, that's what I do. I write down exactly where I want it to go. So yes, you can.
Great. Let's see, we have this question. Have you had a chance to see how effective the programs are in having students attend TJU SKMC from historically Black colleges and universities and various from underrepresented urban youth? And does it also extend into mentoring while in school?
So the answer is no, we have not. And I'll say that we track all of the numbers. We track where people have gone. I don't believe that we've had enough time to be able to see a real difference. Now, that's my opinion. we've seen, so I can tell you, for instance, our Step Up Medicine program, when we look at how many people have applied to medical school coming out of our program. So I'm going to say that in the, let's say we've had 32 students over the last 3 years, perhaps 10 of them have ended up applying to medical school, and they're all in various stages of their application. 8 of them have gotten into medical school. So that's a pretty good success rate as far as the programs go. As far as the effect on enrollment in the Sidney Kimmel Medical College, we've not seen a great increase. Now, that's all relative because our numbers are so low that when we even get 1 or 2 additional, that might actually mean something. But I just don't think we've had enough time to see any significant difference. I don't know what the horizon is on that, but we've not seen that. And then I think that something about mentorship, what that is the intent. The intent is to be involved in a young student's life. We actually believe that you have to start in elementary school because the older a student gets, the more likely they'll miss out on opportunities, be it experiences to get them interested, but probably more important, they'll miss out on opportunities for academic enrichment. And that is what we are that is what we're doing. What we've done is we've established partnerships with elementary, middle, and high schools. We're now forming them with colleges, but the intent is we'd like to engage somebody in elementary school level, provide them with experiences and academic enrichment, because we want to help them all the way. We want to help them get from one step to the next, to the next, to the next. So it's one thing to say, here, why don't you come shadow us in the hospital? That's one thing. It may generate interest. On the other hand, it doesn't assure that they'll get to the next level. And that's why we have counselors that work in our pipeline program. We put students through courses, and we're building on it. But that is the intent, is to engage them, mentor them, and provide them with the enrichment that they need to succeed all along the way.
Great, and so I think we only have time for one more question. Those of you that did ask a question that we didn't get a chance to answer, I will send those along to Dr. Lopez, and he'll be able to reach out to you one-on-one with some answers. But I think our last question for the evening is from one of our double graduates from undergrad PhillyU and pharmacy here at Jefferson, and they ask, from the workforce point of view, is there a way to increase minority worth in the medical field? In other words, I am one of the few Spanish-speaking pharmacists in South Jersey, but I feel as though my employer doesn't even care.
That's one of the key. I don't know. You'd say, if we could find a way. So I believe that the hardest part of our efforts is getting people to see the value of diversity, to see the value of having someone or people who come from a variety of backgrounds, life experiences. If I could find the answer to that, we'd probably solve a lot of things, not just in healthcare, but really in the world. That's a key, just a very important question. How does one do that? I'm not sure what to do, so I'm not sure about how you get a supervisor or somebody higher up to see the value of that. I'm biased. This is the work that I do, but scientifically, there's great benefit to having that diversity, to having people from different backgrounds, experiences, because they really bring something that other people don't bring. I wish I had the answer to that.
Well, great. Thank you so much, Dr. Lopez, for doing this presentation with us. For everyone that's still on the line, we are recording this presentation, so we will be posting it, and we'll also be sending it out to everyone who attended and those that may have registered and didn't have a chance to join us this evening. Again, please feel free to send any other questions you might have to alumni@jefferson.edu, and we can send those along to Dr. Lopez. And I wanted to thank you all again for joining us, and have a wonderful evening.
If I could just say one thing for those of you who are on the line and have questions, I encourage you to send them along the way, and I promise I will answer your questions. This is an area, it's relatively new to TJU in the sense that it's new, the focus in this area, a lot of new things. I'd be very interested in hearing your thoughts and your questions, and I'd be happy to answer every single one of them.
Great, wonderful. Thank you all again, and thank you again, Dr. Lopez. Everyone have a wonderful night.
All right, take care, everybody.